भी रही। अस्सलाम वालेकुम। आज हम अपना नेक्स्ट टॉपिक स्टार्ट करेंगे द फुट इन स्पोर्ट्स फिजिकल थेरेपी। कंटेंट हमारे पास है हाई आर्च या फिर सेमी रिजिड फीट, फ्लैट फ्लेक्सिबल फीट, फुट इंजरीज में फिर हम देखेंगे हील कंटूजन्स, कैल्केनियल स्ट्रेस फ्रैक्चर, टार्सल टनल सिंड्रोम, सेवर्स डिजीज, रिट्रोकैल्केनियल बर्साइटिस एंड हैगलैंड्स डिफॉर्मिटी, एक्लिस टेंडिनोपैथी, एक्लिस टेंडिनो रप्चर, पेरोनियल टेंडन इंजरीज। और फिर हमारे पास आ जाते हैं मिडफुट इंजरीज में हम देखेंगे मिडफुट टेंडिनोपैथी, टिबियालिस पोस्टीरियर टेंडिनाइटिस, टार्सल कोलाइशन, कुबाइट सिंड्रोम, निस्फ्रेनिक फ्रैक्चर या फिर डिस्लोकेशन। और फोरफुट में हमारे पास आ जाती है न्यूरल साइन, मेटाटार्सल फ्रैक्चर, फिफ्थ मेटाटार्सल फ्रैक्चर, हेलिक्स इंजरीज एंड हेलिक्स सेसामाइड इंजरीज। फुट इन स्पोर्ट्स फर्स्ट कंडीशन है हमारे पास हाई आर्च्ड एंड सेमी रिजिड फीट। द कंडीशन ऑफ दीज फीट कैन बी डिपिक्टेड इन एक्सट्रीम फॉर्म्स एज पेस्केवस और क्लाफुट. This foot abnormality, mainly inherited in, characterized by significantly high arch that lacks flexibility. It commonly accompanies tight calf muscles, limiting dorsiflexion, and tends to cause running even at slow paces with minimal or no contact of heel. ट्रीट इसको कैसे करते हैं हम? ट्रीटमेंट स्ट्रेच काफ मसल्स, क्योंकि काफ मसल्स इसमें टाइट मिलते हैं, पार्टिकुलरली आफ्टर एक्टिविटी फॉर अराउंड 30 सेकेंड्स, रिपीटेड 3 टाइम्स डेली। हमने 10 रेपिटेशंस करनी है और हर रेपिटेशन को हमने 30 सेकेंड्स तक होल्ड करना है। हाई आर्च्ड सेमी रिजिड फीट में हमने देखा है ये पेस्केवस या क्लाफुट में ज़्यादा हमें मिलता है और इसकी वजह से फ्लेक्सिबिलिटी कम होती है, काफ मसल्स जो हैं वो टाइट होते हैं। काफ मसल्स के टाइटनिंग की वजह से डोर्सिफ्लेक्शन कम मिलेगी हमें। और फिर हमने इसका ट्रीटमेंट देखा है, जो टाइट मसल्स थे उनको हमने स्ट्रेच किया है। सेकेंड कंडीशन है फुट की हमारे पास फ्लैट फ्लेक्सिबल फीट। दिस काइंड ऑफ फ्लैट एंड फ्लेक्सिबल फीट नीड्स स्पेसिफिक शूज चॉइसेस टू कंट्रोल मूवमेंट, preventing strain on certain body parts during activities. At the same time, these shoes should permit enough movement to handle more extended impact during activities. ये कंडीशन अब हमारी उसकी अपोजिट हो गई हाई आर्च की, जिसमें जो आर्च होती है हमारी मीडियल आर्च वो बिल्कुल ख़त्म हो जाएगी। तो मोस्टली हम जो स्पेसिफिक मेडिकेटेड शूज़ होते हैं वो पेशेंट को रिकमेंड कर रहे होते हैं और उसमें पेशेंट को हम एडवाइस करते हैं कि वो बेयर फुट के साथ ग्राउंड पे ना चले। काज क्या होती है या फिर करेक्शन इसकी अब कैसे होगी? इंजरीज फ्रॉम ईदर एक्सेसिव यूज़ आर ड्यू टू स्ट्रक्चरल इरेगुलरिटीज स्पेसिफिक टू स्पोर्ट्स आर alike in sense that they often become apparent only after considerable activity. With the appendance of the shoes option, insole and orthotic devices, there chance to find the correct combination of lower injury risk. However, this also raises the necessity for more expertise and understanding of sport-specific shoe design and prescribing biomechanical aid. इसमें पेशेंट को मसला तब होगा जब वो बहुत ज़्यादा एक्टिविटी करेगा, आफ्टर एक्टिविटी पेशेंट को पेन होगा। तो इस चीज़ को ट्रीट करने के लिए हम पेशेंट को इंसोल्स रिकमेंड करते हैं, आर्थोटिक डिवाइसेस या फिर मेडिकेटेड शूज़ की तरफ लेके आते हैं। थर्ड कंडीशन है हमारी फुट इंजरीज। अब फुट इंजरीज को हम एनाटमिकल बेसिस पे 3 पार्ट्स में डिवाइड करते हैं, रियर फुट इंजरीज, मिड फुट इंजरीज और फोर फुट इंजरीज। रियर फुट इंजरीज में हमारे पास प्लांटर fasciitis आ जाएगा, हील कंटूजन है, कैल्केनियल स्ट्रेस फ्रैक्चर है, टार्सल टनल सिंड्रोम, सेवर्स डिजीज, रिट्रोकैल्केनियल बर्साइटिस, एक्लिस टेंडिनोपैथी, एक्लिस टेंडन रप्चर, पेरोनियल टेंडन इंजरीज। मिड फुट इंजरीज में हमारे पास आ जाती है मिड फुट का स्ट्रेस फ्रैक्चर, मिड फुट टेंडिनोपैथी, टिबियालिस पोस्टीरियर टेंडिनाइटिस, टार्सल कोलाइशन, मिड टार्सल जॉइंट स्प्रेन, क्यूबाइट सिंड्रोम एंड लिस्फ्रेनिक फ्रैक्चर या फिर लिस्फ्रेनिक डिसलोकेशन। फोर फुट इंजरीज में हमारे पास आ जाएंगी मेटाटार्सल की इंजरीज, न्यूरल साइन, मेटाटार्सल फ्रैक्चर, फिफ्थ मेटाटार्सल फ्रैक्चर, हेलिक्स इंजरीज एंड हेलिक्स सिस्टमाइड इंजरीज। सबसे पहले हम देखेंगे रियर फुट इंजरीज को। रियर फुट इंजरीज में जो पहली कंडीशन है वो है प्लांटर fasciitis। Plantar fasciitis refers to inflammation of the plantar fascia, causing pain in arch of the foot. This discomfort worsens with weight-bearing activities. It is an overuse injury resulting in proximal and medial foot pain, which might extend towards the mid-arch. Strain or even tearing due to gradual or sudden excessive stress is common, particularly among active individuals in sports. Association and predisposing factors. Plantar fasciitis can be associated with a heel spur. What is heel spur? Heel spur is a bony growth at the plantar fascia attachment to the heel bone. This heel spur often develops due to repetitive stress on the foot, sometimes present even without causing symptoms. Conversely, a painful heel might not be necessarily have a heel spur. Predisposing factors include increased body weight, pronation or ankle eversion, prolonged period of standing, reduced ankle dorsiflexion and high arch. Second condition rear foot में है heel contusion. Heel contusion is a bruise to the heel resulting from direct impact on or repetitive stress. Management involve rest, ice, elevation, compression, and pain management techniques. In which sports heel contusion happen? The heel contusion can occur in various sports including basketball, soccer, running, and activities that involve jumping or sudden impact on feet such as gymnastics or volleyball. Third condition of rear foot is calcaneal stress fracture. Calcaneal stress fracture is a hairline break in the heel bone due to repetitive strain. Management typically involves rest, immobilization, gradual return to weight-bearing activities. Sports include these injuries may occur include running, long distance walking, basketball, soccer, gymnastics, and activities that involve jumping or sudden changes in direction. Third condition of rear foot injuries is the tarsal tunnel syndrome. Tarsal tunnel syndrome involves compression of the posterior tibial nerve in the ankle, leading to pain, tingling, and numbness. Management include rest, orthotic physical therapy. In severe cases, surgery may be required. In which sports it occurs? It commonly associated with activities that involve prolonged walking, running, or activities that put pressure on the feet and ankle like soccer, basketball, running, and even activities like hiking or dancing. Fifth condition is Sever's disease. Sever's disease is heel condition in children due to repetitive stress causing inflammation of the growth plate. Management involves rest, stretching, heel contusion, and modifying physical activities. Sports include it commonly seen in sports that involve repetitive running, jumping, or activities that puts stress on the heel, such as soccer, basketball, gymnastics, track and field event like sprinting and high jumping. Sixth condition is retrocalcaneal bursitis or the Haglund's deformity. Retrocalcaneal bursitis and Haglund's disease involve inflammation of bursa and bone growth on the back of the heel. Management includes rest, ice, anti-inflammatory medications, heel pad, and sometimes physical therapy or surgery for severe cases. Sports include this condition is often seen in sports like running, soccer, tennis, activities that require frequent jumping or sudden changes in direction, causing stress on the back of the heel. Seventh condition of rear foot is Achilles tendinopathy. Achilles tendinopathy is a condition involving degeneration or inflammation of Achilles tendon due to overuse or repetitive stress. Management include rest, stretching, strengthening exercises, orthotics, and in severe cases, physical therapy or surgery. Sports include commonly running, basketball, soccer, tennis, volleyball, and activities that involve high impact movement, stressing the Achilles tendon. Ninth condition is Achilles tendon rupture. Achilles tendon rupture is a complete or partial tear of the tendon, usually caused by sudden force or overstretching. Management of Achilles tendon rupture involves immobilization with a cast or boot and may require surgery for optimal repair in some cases. Sports include Achilles tendon rupture may happen in basketball, soccer, tennis, football, running and sprinting, gymnastics. These sports involve abrupt movement, jumping, pivoting, or sudden accelerations that can put excessive stress on the Achilles tendon, potentially leading to a rupture. Last and 10th condition of rare foot is the peroneal tendon injuries. Peroneal tendon injuries involve damage to the peroneal tendon or ligaments due to trauma or overuse. Management includes rest, compression, elevation, bracing, physical therapy, and in severe cases, surgery might be necessary for repair. Sports may be observed soccer, basketball, football, tennis, running, especially on uneven surfaces, skiing, snowboarding, dancing. These activities often involve lateral movement, sudden changes in direction, or ankle rolling, which can strain or injure the peroneal tendons. Next topic is midfoot injuries. First condition in midfoot injuries is midfoot stress fracture. Midfoot stress fracture is a small crack in the bone of the midfoot due to repetitive strain. Management involves rest, immobilization, gradual return to weight-bearing activities, and sometimes the use of supportive devices like walking boot or the crutches. In sports, midfoot stress fracture can occur in sports that involve repetitive impact or stress on the midfoot area. Athletes participating in activities like running, ballet dancer, gymnastics, basketball, soccer may be prone to midfoot stress fracture due to repetitive nature of these sports, which can place significant stress on the midfoot bones. Second condition of midfoot injury is the midfoot tendinopathy. Midfoot tendinopathy refers to the inflammation or degeneration of tendons in midfoot due to overuse or repetitive stress. Management includes rest, orthotics, physical therapy for strengthening and stretching exercises, and in some cases, corticosteroid injections or surgery may be considered. Sports midfoot tendinopathy can occur in sports that involve repetitive or excessive loading of foot midsection. Athletes engaged in activities like running, dancing, gymnastics are the sports requiring frequent changes in direction, such as basketball, soccer might experience midfoot tendinopathy due to repetitive strain placed on the tendon supporting the midfoot. Third condition of midfoot injury is tibialis posterior tendinitis. Tibialis posterior tendinitis involves inflammation of the tendon supporting the arch of the foot due to overuse or injury. Management includes rest, orthotics, physical therapy for strengthening and stretching, and in severe cases, surgery might be necessary for the repair. In sports, tibialis posterior tendinitis can occur in sports that involve repetitive or intense use of posterior tibialis tendon. Activities like running, hiking, ballet, soccer, and sports that require sudden change in direction, high impact movement may contribute to development of the tibialis posterior tendinitis due to stress placed on the tendon during these activities. Fourth condition of midfoot injury is tarsal collation. Tarsal collation is a condition where there's an abnormal connection between two or more tarsal bones, often present from birth. Management include conservative treatment like orthotics, physical therapy, and in some cases surgery for the severe symptoms or limited mobility. In sports can be present from birth or develop over time. While it is not directly linked to the specific sports, individuals with tarsal coalition might experience symptoms during the activities that involve repetitive stress or motion of the foot, like running, dancing, gymnastics, or sports requiring frequent and varied foot movements. Fifth condition is cuboid syndrome. Cuboid syndrome involves displacement or irritation of the cuboid bone in the foot due to overuse or trauma. Management include rest, manipulation, taping, orthotics, and physical therapy to alleviate symptoms and restore normal foot mechanics. In sports can occur in sports that involve repetitive or forceful foot movement. Athlete participating in activities like running, dancing, gymnastics are the sports requiring frequent foot inversion or eversion motions like soccer, basketball might be more susceptible to developing cuboid syndrome due to the stress placed on the cuboid bone during these activities. Next condition in midfoot injuries is the lisfranc fracture or lisfranc dislocation. Lisfranc fracture or dislocation is an injury involving midfoot tarsometatarsal joint due to direct or twisting trauma. Management often necessitates surgical intervention for severe cases, while mild cases might be treated with immobilization, rest, and rehabilitation. In sports that might be associated with Lisfranc fracture include football, soccer, rugby, equestrian sports, and activities involving downskiing and snowboarding. Now we see forefoot injuries. First condition in forefoot is metatarsal injuries. Metatarsal injuries involve fracture of stress fracture in long bones of the foot due to direct trauma, overuse, or twisting. Management include rest, immobilization, sometimes surgery, and gradual return to weight-bearing activities through rehabilitation. In sports, variety of sports that involve running, jumping, sudden changes in direction, and high-impact activities. Some sports where metatarsal injuries are commonly seen include soccer, football, basketball, running, gymnastics, dancing, and activities with repetitive stress or direct trauma to the feet. Second condition in forefoot is neural sign. What is neural sign? Neural sign typically refers to the symptoms related to the nerve damage or the compression resulting from various injuries or the condition. How we manage it? Management involves identifying the underlying cause, often requiring a combination of medication, physical therapy, nerve blocks, or in severe cases, surgical interventions. Which sports involve in neural science? Sports involving repetitive motion impact our positions that put pressure on the nerves, such as cycling, weightlifting, gymnastics, contact sports like football, rugby, could potentially lead to neural sign or nerve related issues. Third condition in forefoot is metatarsal fracture. Metatarsal fracture involves a break in one of the long bone of the foot due to direct trauma or the repetitive stress. Management include immobilization, rest, possibly surgical intervention, and gradual return to activities through rehabilitation. In sports, sports commonly associated with metatarsal fracture include soccer, football, basketball, running, gymnastics, dancing, and any activities where there's frequent foot stress or impact on hard surfaces, increasing the risk of injury to these bones in the foot. Now, the fourth condition in forefoot injuries is the fifth metatarsal fracture. A fifth metatarsal fracture typically involves the base or the shaft of the fifth metatarsal due to direct trauma or twisting injuries. Management varies from non-weight bearing with immobilization to surgical intervention depending on the location and severity of fracture. Fifth metatarsal fracture occurs in different sports that involve repetitive stress, sudden movement, or direct trauma to the foot. Sports associated with higher risk of the fifth metatarsal fracture include basketball, soccer, football, dancing, and activities where there's frequent foot twisting and rolling, leading to an increased chance of injury to this area of the foot. Second last condition in forefoot is hallux injuries. Hallux injuries involves damage to the big toe, often caused by trauma or overuse. Management include rest, splinting, ice, pain management, and sometimes surgical correction for severe cases or structural issues. In sports, the hallux or the big toe can sustain injuries in various sports that involve sudden movement, pivoting, or direct trauma to the foot. Some sports where hallux injuries are common include soccer, basketball, football, running, dancing, gymnastics, and activities that involve quick changes in direction or significant impact on the feet. Last condition of forefoot is the hallux systemite injuries. Hallux systemite injuries refers to damage or fracture of the small bones, which are called systemites, beneath the big toe joint due to trauma or overuse. Management include rest, immobilization, orthotics, and sometimes surgery for these severe cases or non-healing fracture. In sports, hallux systemite injuries can occur in various sports that involve repetitive stress, trauma to the foot, particularly activities requiring quick and forceful movements such as dancing, soccer, football, बास्केटबॉल, टेनिस एंड रनिंग। ये टॉपिक हमारा कंप्लीट हो गया। बहुत ही आसान सी कंडीशंस थी फोरफुट, मिडफुट और हाइंड फुट की। नेक्स्ट इंशाल्लाह हम मिलेंगे किसी और टॉपिक के साथ। तब तक के लिए अल्लाह हाफिज़।